All right, good afternoon. I'm Dr. Marlon Simpson, a clinical psychologist specializing in neurodevelopmental and neurodegenerative disorders.
All right, Doc. So we're on part two of mental health because we know it's a wide spectrum. So this time we're going to go a little bit more in depth. So what is a mental health disorder?
All right, so a mental health disorder is when there's absence of psychological wellness, means that there's a problem that's bothering you either at home and or at school or work and in social situations that affect you to the point where you can't function properly.
Okay. All right. So what are some of those symptoms that comes with a mental health disorder?
All right, so I have to bear in mind that there are over 150 mental illnesses diagnosable at this point in time. So every mental illness has a particular set of symptoms that are associated with it. So, for example, for depression, has to be over 2 weeks. There's sadness, of course. There's that feeling of hopelessness. There's a sense of doom and gloom, or you're being punished or guilty. So everyone has a set recipe in terms of diagnosing a mental illness.
Okay. All right. So does it require medication to treat any of these disorders?
Right. So definitely quite a few of the mental illnesses do require medication, but we oftentimes say there's a link. You need medication and therapy or counseling to manage the symptoms. So things like schizophrenia, borderline personality disorder, bipolar disorder, even for some persons, autism and ADHD do require medication to help with the symptoms.
All right. So is there any side effects of this medication? And if they are they long-term side effects? And if the patient has to take them, is it like for a long-term period?
All right, so it depends on the medication, but more likely a medical doctor will be able to guide you in terms of what medications, what the side effects are and how to manage them, because not everybody gets the side effects. Not everybody has the same kind of side effects even. Um, and some persons don't have any side effects at all. But some of them or most of the side effects, as I've seen, are short term. So you mean like nausea, sometimes upset stomach, dry mouth, sometimes headaches, things like that. But when we Google these things, it can give us some problems because it will give us all the side effects. So we think everybody will get all of them. Not
Okay.
necessarily the case.
And if you are diagnosed and you have to take medication, it would be a long-term thing. Is it like a life sentence that you have to take these medications?
Not necessarily, actually. Over a period of a year or two or even more, you'll find that once you're being managed well on the medication, they tend to give you less and less each time. And for some persons, it's even once a month. Some persons even skip a couple months, depending on what they're being treated for, or you can just be off of it totally altogether. But for some, depending on the severity of it, you may have to be on it for a long time, but not necessarily for life.
Okay. All right. So we're going to get a little bit more in depth now and speak on some specific ones, like, for example, bipolar. So what is a bipolar disorder?
All right, so bipolar disorder is a fluctuation between extremes of mood. So we talk about mania um, and depressive symptoms. So there are different types of bipolar disorder actually. So bipolar type 1 or bipolar 1 is where you have one manic episode where you feel like you can do anything in the world, you can paint the whole place, and then once you realize that you're not able to, you plummet into depressive symptoms, sadness, frustration, hopelessness. And usually for bipolar 1, you only have one manic episode or a few. For bipolar 2, you cycle between mania and hypomania. So you have high moments and then you have low moments and you
Okay.
fluctuate.
Also, and then the symptoms would be basically sadness.
Sadness for the low moments.
Okay. All right. So, how does bipolar disorder? How does that affect the day-to-day life?
All right. So because you're having racing thoughts, well, if it depends on the type of bipolar that you have. Again, there's several
Mm-hmm.
types, but depending on the type you have, you may have moments where you're having racing thoughts. You can't concentrate for long. You're having problems with focusing. You feel like you can accomplish them, and on the opposite end, you feel like there's just no purpose. There's no drive to do anything at all.
Right.
Mhm.
And what are the treatments that based on the level of bipolarness?
All right, so you have different types of medication that will stabilize your mood. So if the person's having mostly depressive symptoms, then you'll get more mood stabilizers or antidepressants rather. And then if you're fluctuating between both, you will have medications to manage or equalize the mood, as it were.
Okay.
Mhm.
All right. So we're going to go into schizophrenia. Can you tell me what is schizophrenia and tell the public if it's different from bipolar?
All right, so schizophrenia is a completely different disorder altogether. It's characterized by hallucinations, so seeing things that are not there, hearing things that are not there. You have delusions, which is characterized by feelings of I can do great things, or the government is listening to me through the walls, or things like that. Then you also have what we call a word salad, where there are just problems with communication. So it's more of a psychotic disorder.
Okay. And when that disorder chips in, can you say what some of the symptoms are that is noticeable?
Right. So amongst those that I've mentioned, you'd also have what they call positive and negative symptoms. So what I described earlier are positive symptoms. So
Mm-hmm.
hallucinations, delusions. But then in terms of negative symptoms, you do have depression, you do have loss of function, not wanting to do anything.
Okay. And what would trigger a schizophrenia?
Usually stressful situations can trigger it, but it's already present in your system. So if you have a family member, so it's genetic mostly,
Mm-hmm.
it's hereditary. So if your family member, mother, father, aunt, uncle, cousin, has a mental illness, you are predisposed to any, including schizophrenia. But usually stressful events bring up the symptoms.
Okay. And say a patient comes to you, doc, how would you diagnose that person that, this is schizophrenia?
All right, so we have to go through the diagnostic criteria. So figuring out what are the symptoms that the person has. Does it match with what schizophrenia is based on the symptoms you had mentioned before?
Mm-hmm.
And then we make a diagnosis. The person either comes to me second or first, but then we co-diagnose with a psychiatrist to help with management of both medication-wise and therapy.
Okay. And can you tell a little bit how schizophrenia is managed?
All right, so usually we manage schizophrenia through medication. So the doctor will decide what kind of medication person will need, how much for how long, and then through therapy as well, we work through some of the issues that the person may be having. So person may say, I'm not feeling as active or not as good. So we do a lot of work in terms of guiding the person through the correct steps to manage all that they're experiencing.
Okay. All right. So we're going to move on now, and we're going to talk about psychotic disorder. How does psychotic disorder works?
All right, so schizophrenia is a type of psychotic disorder. So usually it entails abnormal behavior. So that's excessively loud, aggressive. In some instances, some persons feeling as though they're losing control. They're not having a full sense of conscious behaviors. Out of it is just their person unsure of what they're doing and cannot control the behaviors.
Okay. So other than schizophrenia, what are some of the other ones under psychotic disorder?
All right, so you have schizoaffective, you have um, delusional disorders. You have quite a few of them, as a
Okay.
matter of fact. Yeah.
And so what are some of the common thread that cause the significant distress in the day-to-day activity that would affect a person going through a psychotic disorder, doc?
All right. So we talk about symptoms that are precipitating and symptoms that are presenting. So it's what is causing the actual problem for the individual. It could be stress, it could be family relationships, but usually it's pent up energies. It's things that have not been dealt with for a long period of time
Right.
that start causing the symptoms to come out more or be more prevalent as the person gets older.
And is there any others that we would want to look out for that are common?
In terms of
The disorders, like we talk about the schizophrenia, the bipolar, and the psychotic disorder. So is there anything else that we would want to look out for that would affect in the day-to-day basis of persons?
all right, so believe it or not, actually, depression can come with psychotic features as well. We have something called complex grief, which can also come with psychotic features. Delirium, Alzheimer's disease, all these different mental illnesses can actually have a psychotic component to them. So you find that the person is acting way out of character, um, probably even tantruming or just having a very negative reaction to different stimuli.
All right. So, how do you recommend that we, the public, deal with persons who are suffering from these mental disorders, such as bipolar and schizophrenia?
All right. So one of the first things to do is to not fall into the stereotype of what people think about these mental illnesses. Not everybody, or actually most of the persons who have schizophrenia and other illnesses, are not necessarily violent. So always educate yourself on what these disorders are. It's a very complicated book, but I would suggest the Diagnostic and Statistical Manual for Mental Illnesses, which is a DSM-5, 5th edition, text revised. That one gives you a sense of all the mental illnesses that persons have and what the symptoms entail. Also, websites like the WHO, even some other notable websites that give factual information, but general Googling is not recommended because you will get a mix of different responses that may not be so factual. So educating yourself. Also, try not to play hero. You cannot save somebody if you're not fully aware of what the person is experiencing. Always seek professional help to manage the persons that are going through different things.
All right, so I'm glad you made the point not to play hero, doc, because I remember I saw something on social media with this young lady where she was helping this guy, but it seems like he had some kind of medical mental illness, right? And she was trying to reach out to him, and the guy was getting a bit aggressive towards her. So, how would you recommend that persons deal with persons out there in this situation? Because would you say they can get dangerous?
Situations can get dangerous, especially if the person feels like they are being threatened. That's a person with a mental illness or having a psychotic episode. So they perhaps become very defensive, and that's where you may see some of the aggressive tendencies. So it's best to not intervene directly, but call a medical professional. So you can call a hospital, you can call Bellevue Hospital, you can call other places, clinics nearby as well, and they have mental health teams that go out and help to manage persons with mental illnesses. In some instances, police are oftentimes engaged as well to safely transport the person to the nearest medical facility to receive treatment. But otherwise, wouldn't recommend anything
But
else.
Doc, you said the police. I've seen situations where you have persons of unsound mind, where the police have to fire warning shots, or even it reach a stage where they have to, you know, move towards making a defensive move, move to protect themselves.
Right, because police are not trained to deal with these situations at all. And so we have to be merciful with the police. They're only reacting based on the training that they have, the limited training that they may have in this perspective. So we really cannot blame police officers for responding in a particular way. So again, the best thing then, or the first line of defense, is to call a mental health professional. Again, a team to come and assist with the person.
Okay. All right. Doc, can you tell us where persons can reach out to you if they would want to get any form of assistance?
All right, so I'm located here at Bellevue Hospital, but I'm also in private practice at Loving Minds Associates Limited. We are on Instagram, we are on TikTok, Facebook is coming up. Our contact numbers are 876-825-1349. We can also reach out to us via email, loveyourmindassociates@gmail.com or lovingmindsassociates@gmail.com.
And can you tell them what some of the services that you offer there, Doc?
All right, so we do quite a few neurodevelopmental assessments. That includes assessments for autism spectrum disorder, ADHD. If you have neurodegenerative disorders, so like dementias, TBIs, traumatic brain injuries, stroke, those things, we help to treat our diagnosed persons and help get them the help that they need. We also do individual counseling, family counseling, couples therapy, and we do various other types of assessments, including psychoeducational assessments, neuropsychological assessments, and behavioral and personality assessments as well.
Okay, thank you so much, Doc.
All right, no problem.